Off-label is becoming a pretty popular term these days, isn't it? So off-label refers to FDA-approved medications that are being used not for what they were approved for. So they're being used off-label. So for example, as a genetic cardiologist taking care of patients with genetically mediated long QT syndrome, many of the medications I use that are FDA approved and I can prescribe are actually off-label for the disease called long QT syndrome. So here we have example in the setting of COVID-19, where now everybody has heard the phrase off-label, that we have drugs like hydroxychloroquine, like chloroquine, like some of the HIV antiviral drugs and so forth, where hydroxychloroquine is an FDA-approved medication around for 70, 80 years, approved for the clinical indication or the label of malarial disease or malaria prevention and for lupus rheumatoid arthritis. So it's an FDA-approved drug for those purposes, but if we're thinking we want to use it to treat coronavirus and COVID-19 disease, it's available. I can write a prescription for it, but it would be viewed as being used off-label. The side effect is pretty impressive. Drug-induced sudden cardiac death. The solution is quite easy, and it starts with know your QTC, because that measurement that we can get from a 12-lead electrocardiogram, that we can get off of telemetry, that we can even now get, thanks to the FDA's emergency approval last week, from a smartphone device, where we can learn and get your QTC value. That value tells us a lot, and as we put forward in our guidance, it can tell you green light go. You are QTC safe. This drug should be incredibly safe in you, and we will get the green light go signal for over 90% of all of us. It's really then flagging the 5 to 10% of us, and especially the 1% of us who are already telling us that our QT system is twitchy, it's on edge, it's higher than normal, and in a perfect storm, I'm fragile, my potassium is low, my magnesium is low, I happen to be on another medicine that's QT agitating, and now I add hydroxychloroquine to the mix. That could be an explosive combination, and we can neutralize that threat. But we have to first start by saying, what's my patient's QTC? Is it green light go, safe, clear? Is it yellow light caution territory, or is it at the red light where we better be very, very careful? But it's thought that these medications might interfere with and prevent the entry of the coronavirus, and that in that sense be preventative, or for those where the virus has already entered and doing its inflammatory reaction and causing acute respiratory distress, that drugs like hydroxychloroquine could suppress that inflammatory reaction and actually treat the acute disease of COVID-19. That's what they say, that's what I'm told, that's the hope behind the therapeutic efficacy. There's data, small, in vitro data, that says that it does that to the coronavirus in the dish. And there's some small clinical studies that have come out, the one in France in particular, very small, not the kind of study that would ever be viewed as enough evidence to cause the drug to be labeled for COVID-19 therapy, but it did suggest therapeutic benefit. And so because of that, physicians all over the world and physicians in New York and New York City are prescribing drugs like hydroxychloroquine with or without azithromycin to try to treat COVID-19. They're waiting for data, true data to emerge that would be convincing enough, compelling enough that the FDA would say, wow, the evidence is overwhelming. We need to add COVID-19 as another labeled indication, but a lot of physicians aren't waiting for that body, that volume of evidence to be there, and they're starting to use it because they think that there is going to be therapeutic efficacy, that it might work, might help, and so they're starting to use it. It's critically important. Whether that drug is actually on label or off label, self-medicating is dangerous, and particularly here in the setting of COVID-19, self-treating or getting supplements or finding things that have chloroquine in it can be deadly. These are strong medications and not to be taken as acetaminophen, Tylenol is good for you. We just had a death, I think 2 days ago in Arizona of the couple who somehow found chloroquine phosphate, I think it was, and most likely he died from drug-induced sudden cardiac death. These are strong medications.